Comprehensive NCLEX RN Challenge Exam 10. Question 1. A 65-year-old man is admitted for spinal stenosis surgery. He lives alone in a 2-story house. When should the nurse initiate discharge training and planning? Following surgery. Upon admission. Within 48 hours of discharge. Preoperative discussion. Discharge planning should begin upon admission, or even preoperatively, to ensure all home care needs and potential barriers are addressed early. Question 2. A 5-year-old child appears hesitant to play and frequently asks if it is okay to play with certain toys. Which Erikson stage is the child primarily navigating? Trust versus mistrust, initiative versus guilt, autonomy versus shame and doubt, intimacy versus isolation. Children aged 3 to 6 years are in the initiative versus guilt stage. Excessive hesitation or seeking permission may indicate a struggle with guilt over self-initiated play. Question 3. A 26-month-old toddler is becoming increasingly assertive, wanting to dress themselves, but becomes frustrated and ashamed if they fail. Which Erikson stage is this? Trust versus mistrust, initiative versus guilt, autonomy versus shame and doubt, intimacy versus isolation. Toddlers, 1 to 3 years, are in the autonomy versus shame and doubt stage, where they strive for independence and self-control. Question 4. A 20-year-old young adult expresses concerns about a recent breakup and feels isolated from peers. Which Erikson stage is the young adult primarily navigating? Trust versus mistrust, initiative versus guilt, autonomy versus shame, intimacy versus isolation. Young adults, 18 to 40 years, navigate intimacy versus isolation, focusing on forming deeply personal relationships. Question 5. Which of the following vital signs taken during a school health fair appears to be outside the typical range for the respective age group? 11-year-old athlete, 90 bpm, 22 rpm, 100/70 mmHg. 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. 5-year-old male, 102 bpm, 24 rpm, 90/65 mmHg. 6-year-old female, 100 bpm, 26 rpm, 90/70 mmHg. For a 13-year-old, a diastolic blood pressure of 50 mmHg is lower than the typical range, especially alongside a slightly elevated heart rate. Question 6. A 38-year-old female struggles with depression and an anxiety disorder. Which of the following medications is most likely prescribed for these conditions? Amitriptyline, Elavil, calcitonin, pergolide mesilate, Permax, verapamil, Calin. Amitriptyline is a tricyclic antidepressant, TCA, commonly used to treat depression and sometimes off-label for anxiety. Question 7. A patient has a history of respiratory infection, Legionnaire's disease, and multiple sclerosis, MS. For which condition would the nurse question the administration of erythromycin? Recent bacterial respiratory infection, past episode of Legionnaire's disease, family history of campylobacteriosis, long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used for bacterial infections. It has no therapeutic role in treating multiple sclerosis, which is a neurological autoimmune disease. Question 8. Based on a history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to an acute episode? Decreased HR, paresthesias, muscle weakness of the extremities, migraines. Hyperkalemia, high potassium, affects muscle and cardiac function, weakness, bradycardia, paresthesia, but is not a cause of migraines. Question 9. A patient is suspected of having diabetic ketoacidosis, DKA. Which of the following symptoms reported by the patient would the nurse consider atypical for this condition? Persistent nausea and vomiting, an insatiable feeling of thirst, polydipsia, a noticeable increase in weight over a short period, a distinct fruity odor on the breath. DKA typically causes dehydration and fluid loss, leading to weight loss, not a short-term increase in weight. Question 10. A nurse suspects acute meningitis in a patient. Which of the following symptoms reported by the patient would the nurse consider not expected for this condition? A sudden increase in appetite, episodes of vomiting, high fever and chills, sensitivity to light, photophobia. Meningitis typically causes nausea and a lack of appetite, anorexia, not an increase in appetite. Question 11. A patient has red, itchy eyes with a yellowish discharge. Which microorganism is most likely responsible for this bacterial conjunctivitis? Yersinia pestis, Helicobacter pylori, Vibrio cholerae, Haemophilus aegyptius. Haemophilus aegyptius is a common causative agent of acute bacterial conjunctivitis, pink eye. Question 12. A patient with a bullseye rash and joint pain has Lyme disease. Which microorganism is responsible? Borrelia burgdorferi, Streptococcus pyogenes, Bacillus anthracis, Enterococcus faecalis. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks. Question 13. An 87-year-old female has increased confusion, falls, and mild left hemiparesis. Which test is most likely to be performed? CBC, complete blood count, ECG, electrocardiogram, thyroid function tests, CT scan. Sudden onset of hemiparesis, weakness on one side, and confusion in the elderly necessitates a CT scan to rule out a stroke or intracranial bleed. Question 14. An 85-year-old male is losing mobility, gaining weight, and runs the heater even on warm days. Which test is most likely to be performed? CBC, complete blood count, ECG, electrocardiogram, thyroid function tests, CT scan. Weight gain, lethargy, and cold intolerance, running the heater, are classic symptoms of hypothyroidism, requiring thyroid function testing. Question 15. A 20-year-old college student is found unconscious with a fever and a rash. Which of the following tests is most likely to be performed first? Blood sugar check, CT scan, blood cultures, arterial blood gases. Fever, rash, and altered consciousness in a young adult suggest meningococcemia or meningitis. Blood cultures are a priority for identifying the pathogen. Question 16. Which behavioral characteristic describes the domestic abuser? Alcoholic, overconfident, high tolerance for frustrations, low self-esteem. Domestic abusers often have low self-esteem and use violence or control to compensate for feelings of inadequacy. Question 17. The nurse is caring for a client with a long leg cast. Which exercise should the nurse recommend for the affected extremity? Isometric, range of motion, aerobic, isotonic. Isometric exercises, contracting muscle without moving the joint, help prevent muscle atrophy while the limb is immobilized in a cast. Question 18. A woman in her first pregnancy has multiple sex partners and is unsure of the baby's father. Which intervention is a priority? Counsel the woman to consent to HIV screening. Perform tests for sexually transmitted diseases. Discuss her high risk for cervical cancer. Refer the client to a family planning clinic. While all are important, counseling for HIV screening is a priority to prevent mother-to-child transmission during pregnancy. Question 19. A 16-month-old child clings to the mother and begins to cry when the nurse enters. What is the initial action by the nurse? Arrange to change client care assignments. Explain that this behavior is expected. Discuss the appropriate use of timeout. Explain that the child needs extra attention. Separation anxiety and fear of strangers are developmentally normal behaviors for a 16-month-old toddler. Question 20. While planning care for a 2-year-old hospitalized child, Which situation is most likely to affect the behavior? Strange bed and surroundings. Separation from parents. Presence of other toddlers. Unfamiliar toys and games. For a hospitalized toddler, the greatest stressor is typically separation from their primary caregivers, parents. Question 21. While explaining an illness to a 10-year-old, what should the nurse keep in mind about cognitive development? They make simple associations of ideas. They are able to think logically in organizing facts. Interpretation originates from their own perspective. Conclusions are based on previous experiences. According to Piaget, 10-year-olds are in the concrete operational stage and can think logically about concrete facts and events. Question 22. The nurse has just admitted a client with severe depression. From which focus should the nurse identify a priority nursing diagnosis? Nutrition, elimination, activity, safety. In severe depression, the risk of self-harm or suicide is the highest priority. Safety must be addressed before other concerns. Question 23. Which playroom activities should the nurse organize for a group of 7-year-old hospitalized children? Sports and games with rules. Finger paints and water play. Dress-up clothes and props. Chess and television programs. School-age children, 6 to 12 years, enjoy competitive play and games that follow established rules. Question 24. A client is discharged following hospitalization for congestive heart failure. Which rest position is most helpful? High Fowlers, supine, left lateral, low Fowlers. High Fowlers, sitting upright, decreases venous return and eases the work of breathing, which is essential for CHF patients. Question 25. Which assessment parameter indicates that a 10-year-old on the burn unit has adequate fluid replacement? Urinary output of 30 milliliters per hour. No complaints of thirst. Increased hematocrit. Good skin turgor around burn. Urinary output of 0.5 to 1.0 ml/kg/hr, roughly 30 ml/hr for an average child, is the best indicator of adequate kidney perfusion and fluid resuscitation. Question 26. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Acute pain related to biologic and chemical factors. Anxiety related to change in health status. Hopelessness related to physiological condition. Risk for side effects related to medical therapy. The hallmark of a migraine is severe, debilitating pain. Addressing acute pain is the immediate priority. Question 27. Which key item should be included in the teaching plan for newly diagnosed migraine headaches? Select all that apply. Avoid foods with tyramine, alcohol, aged cheese. Avoid drugs such as Tagamet and nitroglycerin. Abortive therapy is aimed at the aura phase. Medications can cause rebound headaches. Avoiding triggers, like tyramine-rich foods, is a cornerstone of migraine prevention and management. Question 28. A patient has a seizure. After the seizure, which action can you delegate to the nursing assistant, UAP? Document the seizure. Perform neurologic checks. Take the patient's vital signs. Restrain the patient for protection. Taking vital signs is within the scope of practice for a nursing assistant. Documentation and neuro checks require nursing judgment. Question 29. You are preparing to admit a patient with a seizure disorder. Which action can you delegate to the LPN/LVN? Complete admission assessment. Set up oxygen and suction equipment. Place a padded tongue blade at the bedside. Pad the side rails before the patient arrives. LPNs can set up standard safety equipment. Padded tongue blades are contraindicated, and admission assessments must be done by an RN. Question 30. A student is teaching about epilepsy prior to discharge. For which statement should you intervene? You should avoid consumption of all alcohol. Wear your medical alert bracelet at all times. Protect your loved one's airway during a seizure. It's okay to take over-the-counter medications. The nurse must intervene because many OTC medications, like cold medicines, can lower the seizure threshold or interact with antiepileptic drugs.